Let's take a look at this easy situational judgment test question based on empathy and compassion. So the scenario is that Kai is working on a hospital project about improving communication with bereaved families. A colleague makes an offhand joke about how awkward it is to deal with crying relatives. Kai is taken aback by the comment. We need to choose the most appropriate and the least appropriate action that Kai should take. This style of question, we need to read through all of the options first before we can really get a sense of what's the most and what's the least appropriate. So A, speak to the colleague privately to explain why the joke was inappropriate. B, report the colleague to the project supervisor immediately. And C, say nothing and assume it wasn't meant seriously. Quite often, recognizing the least appropriate action is quite easy. Saying nothing is definitely the least appropriate. Now, this is the least appropriate because this is dismissing the unprofessional comments. It allows that culture of insensitivity to persist. It remains unchallenged. So, what about the most appropriate? Speaking to the colleague privately or reporting the colleague? Well, reporting the colleague perhaps escalates it unnecessary. If the behavior was to persist, then it may be necessary. So, this is probably a null option. It's not necessary at this stage. Speaking to the colleague privately addresses the issue calmly in a private setting so that the colleague does not feel attacked in any way, and it encourages reflection on empathy. So A would be the most appropriate response. Let's take a look at this medium level difficulty situational judgment test question based on empathy and compassion. The scenario is that Aman is on the pediatrics ward. A parent becomes upset and accuses the team of not listening to her concerns. The consultant calmly explains the plan but quickly moves on. Aman feels the parent didn't feel heard. This is our level of importance style question, where we need to rank the 4 considerations as being very important, important, of minor importance, or not important at all. Let's take a look at them. So A, acknowledging distress can help to de-escalate the tension. This is very important. As doctors, empathy builds trust and diffuses these emotional situations, and that's really important in the kind of clarity of our explanations so that patients and the family of patients and then close relatives, they can be accurately informed as to what the potential best course of action is going to be. So A is very important. B, the parent might be overreacting. This isn't important at all. It's not for us to say whether the parent is overreacting. Regardless of the cause, the emotions must be acknowledged respectfully. So not important at all. C, there was limited time for discussion on a busy ward round. Now, some people might think that this is not important at all. They might dismiss this and say, well, it doesn't matter, you should make time for them. Their emotions need to be acknowledged. The concerns deserve space. But as a doctor, time is a factor. Doctors are very, very busy. They are very pressured for time. So this is important and worth consideration. And then D, explaining the medical plan clearly enough. This again is of minor importance. The medical plan does need to be clearly explained, so it does have some importance, but equally empathy is a separate and necessary part of care. The doctor or the consultant should have taken more time to address the emotional concerns of the parent, and that would then make the explanation of the medical plan more successful and clearer as well. So minor importance. Let's take a look at this hard situational judgment test question based on empathy and compassion. The scenario is that Sam is shadowing a GP when a young patient arrives for a mental health review. The patient looks withdrawn. After the consultation, the GP seems rushed and tells Sam they didn't ask about the patient's mood because the appointment was already over time. How important are the following considerations? So we need to rank each of these considerations as very important, important, of minor importance, or not important at all. Let's take a look at them. A. Mental health symptoms can be easily missed if not directly asked about. This is very important. These sensitive issues are often not disclosed unless they are prompted. People find it very difficult to talk about their mood and talk about any mental health issues. So it is up to the GP or up to a doctor to kind of ask about these things and prompt that conversation. B, the GP was running late and had many other patients waiting. Time pressure is a real concern for doctors, so this is important. However, this should not override the care that we provide our patients, the empathy that we have for our patients, and making sure there is the time for them to feel considered and heard. C, the patient didn't volunteer anything concerning. This is of minor importance. The reason it's of minor importance is because patients may not always speak up when they are struggling, particularly around mental health. And although they haven't volunteered anything concerning, it should potentially still be in the back of our minds that they haven't raised anything, they haven't said anything. So I wouldn't put this as not important at all. I would just put it as minor importance. D, the GP has seen this patient multiple times before. This is important. Understanding, particularly in these GP roles, having a kind of relationship and a continuity of care when it comes to our patients is really important, and it can help us to better understand the changes in perhaps the behavior, particularly when it comes to mental health, or changes in any symptoms and how that might relate to any conditions that our patients have.